Patients often come and see me with significant pain in their hip joint, where the bone has been exposed as the cartilage has been worn away. They're often on painkillers, using walking sticks, and sometimes they're even in wheelchairs. A hip replacement can very quickly give the patients the mobility they require back by taking that pain away and allowing them within a few hours after the operation to get walking and to start their rehabilitation. It's a very common operation that we do many times a week at the Manor Hospital. The operation takes approximately 1 hour. The hip joint is replaced with an artificial joint with modern materials to ensure that we have a durable and long-lasting joint replacement. These joint replacements now can last 20, 30 years or more because of the new technology and new materials that we are using. The patients often walk the next day after the operation and probably only spend a few days in the hospital before rehabilitating back home. I often see the patients who have these joint replacements fully recovered by 6 weeks when I see them in the follow-up clinic. Whenever we decide on undertaking surgery, we very carefully consider in the clinic room the risks and the benefits of surgery. Of course, any operation has some risks, but on the whole, the operations to replace joints, the risks are well known and well managed, and we can mitigate them with various therapeutic and rehabilitation techniques. The risks such as infection are very low at the Manor Hospital, but we also reduce the risk of getting complications such as thrombosis by giving blood thinners post-operatively. But the benefits of having a pain-free joint very much outweigh the relatively well understood risk of undertaking a joint replacement.